Friends in the back, we're going to get started. Here we go. So you guys ready? Thank you. Who did the whistle? Good job. All right. Well, thank you all for being here. Good afternoon. I'm Pat Dillon, and I want to welcome you to a very special occasion here at Mosaic Life Care. This is a celebration of our 10-year anniversary as a member of the Mayo Clinic Care Network. So we are honored to continue our membership with the Mayo Clinic Care Network. What this means is simple. We work together to put the needs of the patient first. By sharing knowledge, resources, and expertise, Mosaic Life Care physicians can combine their understanding of their patients' medical needs with Mayo Clinic's expertise, then feel how it will benefit their patients. For patients, this means getting more of the care they need from their trusted local physician, close to home, at no additional cost, and most importantly, added peace of mind. I'd like to recognize some special guests that are here in the room today, and if you slipped in the last 10 seconds, I might have missed you. But we have a couple of our county commissioners here. Lee Sawyer, presiding commissioner. Lee, thanks for being here. Scott Burnham, our Eastern commissioner. Thanks for being here, Scott. Mayor John Josendale. Mayor, thanks for being here. And City Manager Brian Carter. Brian, thanks for being here today. We have President Dr. Kennedy from Missouri Western State University in the back. Thank you for being here. And we have Natalie Redmond, the president of our Chamber of Commerce. Hi, Natalie. Thanks for being here. So at this time, it's my pleasure. I'd like to introduce our Chief Executive Officer, Mike Ford.
Thank you, Pat. I am very excited to celebrate our 10th anniversary with our Mayo Clinic Care Network. Mosaic was the 4th hospital in America to join the Mayo Clinic Care Network, and we are thrilled to celebrate this 10-year anniversary. Being a member aligns with Mosaic's value of placing the needs of the patient first. It expands on how we treat and care for our patients with the Mayo caregivers and lives our values, and Mosaic caregivers live the same values. That's why our alignment works very well together over these 10 years. It also ensures that we have access to peers, tools, expertise, and clinical and business processes that help fully capture the value of Mayo Clinic's integrated clinical care. In 2022, Mosaic providers held 221 e-consults with Mayo Clinic providers. Combined with understanding of the patient's medical needs with the world-renowned expertise of Mayo Clinic to provide patients with the care that they need, close to home, at no additional cost to the patient or to the community. On top of this, our caregivers can attend courses, informational exchanges, webinars, and educational events through the Mayo Clinic Care Network. The clinic's collaboration between Mayo Clinic and members of the network benefit not only our caregivers, but our communities and the region. I'd like to introduce Dr. Clark Ottley, Chief Medical Officer of Mayo Clinic Platform. Dr. Ottley is a consultant in the Department of Dermatology at the Mayo Clinic in Rochester, Minnesota. He joined the staff of Mayo Clinic in 1996 and holds the academic rank of Professor of Dermatology, Mayo Clinic College of Medicine and Science. Dr. Ottley received the Mayo Distinguished Clinician Award in 2015. Dr. Ottley.
Good afternoon, everybody. It's been just a beautiful day. Look at this campus. It's gleaming out there. The grass is as green as it could be, the sky perfectly blue. What a great celebration this is. So as Mike said, I'm Clark Ottley, and I'm a dermatologic surgeon at Mayo Clinic, taking care of very serious skin cancers in our patients. but I'm also the Chief Medical Officer of Mayo Clinic Platform, and in that role, I have the real privilege of interacting with our Mayo Clinic Care Network partners. And it has been an awesome honor to be here today to celebrate this 10th anniversary and to just feel and witness firsthand the quality and the passion of the providers on this campus. And so we have the same goal. It's to create a world where every patient can get the best possible care anywhere they are, every day of the year. Being in healthcare, as we've seen over the last couple of years, is a pretty hard job. And it's a wonderful opportunity to periodically step back and reflect on the joy that we have to collaborate and partner with groups that are dedicated to the same mission, that best care for the patient. And mission alignment is really what this is about. And if I walk around Mayo Clinic, anybody that I interact with from an employee basis, I could ask them, what's the mission of Mayo Clinic? They'd immediately say, the needs of the patient come first. And as we're walking around the Mosaic campus, I get that same sense from all of our colleagues. We were in the cancer center with Dr. AJ, and he was so proud of the care that they were giving, and you could see the patients felt so well cared for in a beautiful space looking out on that incredible field. And so you are doing amazing work here. What does it mean? What does this relationship mean for your patients and your community? It means exactly what Mike said. It means that they can stay home with their trusted physicians, getting care nearby with exquisite expertise, and that when their physicians and their nurses need a little extra help, we're one step away, and they can call on Mayo Clinic to be that trusted partner to give advice, or in that rare circumstance, if somebody really needs to come to Mayo Clinic, we can facilitate that and make it happen very quickly and efficiently. It's a beautiful relationship. The accomplishments over the last 10 years of this relationship could be on a list of accomplishments, pages long, but I'll just highlight a few of the ways in which we've interacted recently. Recently, there was a mental health summit down at Mosaic, and we had physicians and providers coming down thinking about ways in which the mental health concerns of our youth can be addressed most effectively. Really important stuff for the health and vitality of our communities. We also had the emergency department physicians up to Rochester, Minnesota, where we talked about that experience in the emergency department. Really difficult time in people's lives, and how do you make it as humane and as comforting as possible, sharing best practices. And then most recently, the ICU teams met together to think about, again, that really high stakes environment. How do we create the best possible outcomes and do it in a humanistic way so that the patients feel and get the best care possible? So great examples of collaboration that help all of us and all of our collaborative members practice at the highest possible level. And one of the threads that we absolutely feel and hear here is Mosaic committed to that highest level quality and compassionate care. So a wonderful relationship. Mike, at this time, I'd like to celebrate and offer you a commemorative gift. We've got a crystal here, and I take it's a little bit fragile. It's got some moving parts, so I'm going to pull it off very carefully, and just delighted to present this to you in celebration and commemoration of the 10-year relationship. We hope there are many more years ahead.
Appreciate that.
All right. Thank you, Mike.
All right. So we did have another guest sneak in. David Foster. David is president of our St. Joe's School District Board. And David, thanks for making it today. Yeah, welcome. Thank you, Dr. Ottley. We appreciate you and all the Mayo team being here today. This is a real honor for us, and we're just excited to have you. At this point, it's my privilege to introduce our Director of Medical Oncology, Dr. Abu Jadi, or we like to say, which is easier to say for me, Dr. AJ. Dr. AJ.
Well, good afternoon. I'm honored to be part of this great group and celebrate this 10-year association with our Mayo Clinic colleagues. I changed my mind so many times just coming from the cancer center here about what am I going to say, but I didn't write anything, so it always comes from the heart is better. Taking care of cancer patients is very hard. It's like every other specialty is hard, but there's something special about cancer patients. It takes a lot about psychosocial, social, economical, and obviously the art of medicine and the art of oncology. And if you can deliver that close to home with your neighbors and your friends in the hospital that you know, in the streets that you know, that adds a lot of benefit, and that's what Mayo Clinic has provided to us. Over the last 10 years that we've been here, we have the data to share that we have a much larger retention of patients to stay in the community and stay at Mosaic just because of the Mayo Clinic collaboration. I can go on and on about the cases, but there are a lot of cases that we interacted that were instrumental in taking care of the patients, but the two that come to mind just walking up here, not too long ago, we had a very young gentleman who got diagnosed with an extremely, extremely rare type of cancer. I had not seen it in my practice. I read about it in books. And his main focus was when we met him, I said, I'm not the expert in this. We need to get the experts. And the experts obviously were at Mayo Clinic. But his mission, his goal was he wanted to graduate with his class, and he did not want to go back and forth to Mayo Clinic to get treated. So we did a lot of work, collaboration initially through a Mayo e-consult and then through personal phone calls, where we have developed with them it's a regimen that takes 1 whole year. So this is a kid that had to go through 1 year of chemotherapy. We didn't even have the regimens. We know about the drugs, but we never built that regimen. So we worked in collaboration with the oncologist and did this very complex chemotherapy regimen over a year in the hospital, in the clinic. And when I saw him 2 or 3 weeks ago, I mean, he's in complete remission. And his first thing when he walked in, he said, I graduated. And so these are the things that put more of a personal touch about that relation. It's not mostly just to send in a consult and get an answer. And not too long ago also we had another very young lady, and that one actually started with Mayo e-consult, then went into a Mayo Clinic conference, which is we touch base a little bit on. We have access to a lot of the multidisciplinary tumor boards. And breast cancer is a very complex disease, and this was a very young lady in her 20s that was born with a mutation that predisposes her to develop multiple cancers. And at age 24, she's had 3 cancers already, and this was her 4th cancer. And again, very emotional, young lady. We have to work multifaceted, more than one discipline, and we use the expertise of the Mayo Clinic because there are certain things that you can do and you cannot do for those patients because you don't want to cause more harm by your treatment. And we started with a Mayo e-consult, then we started with a Mayo breast cancer conference, then we started with a phone call with multiple providers, oncologists, radiation oncologists, surgeons, and a breast oncologist, and we are delivering the care. She was very pleased. Again, she wanted to stay here with her mom during this time so she didn't have to travel back and forth. I can go on and on and on, but the point is we appreciate that relationship. It's, as we said, it sounds like a repetition, delivering the best care, but delivering it locally, and patients stay here. So thank you. And with that, I would like to introduce Dr. Rippy. He's also one of our physician champions at the Mayo Clinic. Okay.
Hi, I'm Bill Rippy. I'm mostly a practicing internal medicine physician. I've had some administrative responsibilities off and on for years. And I will tell you that I came in 1984. 1984 is notable in that the 2 faith-based hospitals merged into one hospital, became Heartland. So I came here that year, and I've seen this whole process evolve. And I will tell you that this has been a breathtakingly amazing place to practice medicine. And part of it is the needs of the patient. Part of the needs of the patient revolve around right care, right time, right place. And we've talked about this for years. We're seeing healthcare kind of migrate in towards patients' homes more and more. At the same time, our relationship with Mayo Clinic gets us the upper end of where the care is rendered. So, primary care is where we make our first contact with patients, whether it's in the home or if they come to the clinic or nursing home, that kind of thing. Secondary care is hospital care. Tertiary care is medical center care where you have multiple specialists. And then Mayo Clinic provides quaternary care, which is kind of tertiary care on steroids, where you have the world's experts. And I have had the good fortune of being able to practice in this system. Right now, my current administrative responsibilities have to do with the care that we provide outside of the hospital. So I partner with another administrative person on home health, hospice, care at home, things that apply to outpatient. But I've also had the opportunity to kind of be a liaison in our relationship with Mayo Clinic. I help manage the e-consult process, and we've worked with Mayo Clinic in developing a referral process where our patients, we kind of have our foot in the door, and our patients in our community kind of get preference over people who just kind of stumble into the Mayo Clinic. We have amazing access to Mayo Clinic, and it's very easy as a referring physician to get patients into Mayo Clinic, and the relationship has just been amazing. So I get to experience, as a practicing physician, seeing care go from patients' homes into the hospital. We still see patients in the hospital, and all the way up to Mayo Clinic, which I don't think has been mentioned yet, but is the #1 hospital in the world, certainly in the United States recently, and they've just reaffirmed that. And so here we are in St. Joe with access to the absolute top care in the world. And what we're doing with Mayo Clinic and inside of our organization is we're building continuity between patients where they are, in their homes, wherever they are, where we can meet them, all the way to the very top health care in the world. And it's just been amazing to see it all happen. So, Pat, you're up. You're back up.
Well, thank you all for your comments, and again, the Mayo Clinic folks for being here. Thanks to the community members who made it out for this special event. This is something we're really proud of. I mean, it is pretty exciting to be connected with Mayo Clinic. And I also want to thank the board members that are here from Mosaic. I think I saw a few of our board members. So thank you all for being here, and at this point, we're going to conclude this part of it. We do have snacks, something to drink. There's a couple beautiful cakes over here if you want to see them before Jim cuts them. But they've got the Mayo Clinic and Mosaic on it. So thank you all for being here, and have a great rest of your afternoon.